But we're in an interesting period right now where institutions, large institutions in the healthcare world, are highly variable. The variation has to do with the extent to which leaders in key top positions really appreciate the strategic asset that information is for their business. It's important for healthcare to be a much more proactive participant in the evolution of the technology. I think I'm finally seeing evidence that more and more institutions are getting it. And those that don't get it are realizing they're really behind and they're losing competitively.
There's just a huge change in 2015 about the way people will research and make a purchase. Right today, if you're looking to buy something, either for your personal use or for your business, first thing you'll do is either look on social media and ask trusted advisors, or you'll Google it.
That's how they search for answers to questions, but they also look for potential sources of services that interest them. And certainly we find restaurants that way, and we find out their locations that way. Why in the world wouldn't we expect to use those kind of resources as an entree into the healthcare system?
The healthcare organizations need to give the tools to the patients so they can use this. And a lot of those tools now are digital.
So with that change, all businesses are now required to optimize their website so that they can get found for people who are looking through the research and looking for understanding about how to solve their problems. Right? That's the difference between what we refer to as traditional marketing and what we now refer to as inbound marketing. And over the last 5 years, healthcare has caught up greatly with trying to understand how to apply inbound marketing in a way that makes sense for their business and provides a good yield.
People sometimes say that healthcare is technology averse, or that physicians are technological Luddites. That's not true at all. If you give physicians something that's clearly superior, that's in their financial interest, they will adopt it immediately.
Even though digital technology has been around for a while, I think in healthcare, we're at the beginning of the boom for the use of digital technology in every aspect of healthcare.
So I think we've seen an evolution in the last decade or so, even in the marketing space for healthcare organizations. And it's not recent that healthcare organizations have realized that they need to get their name out there, that there's a brand recognition that's important. You know, a decade or so ago, you'd probably buy television ads, put ads in airline magazines or local newspapers and the like to try to bring people the attention of your organization, service, etc. And I think that we need to recognize that there's a world now in which much of the marketing that's done outside of medicine is looking to different modes of transmission of information and more interactivity, and also the ability to measure more about what's going on.
Yeah, some of them are a lot further than they think they are, and others are way behind.
I think digital marketing is real important and can be subtle. It doesn't have to be, come see me, I'm the best surgeon in the world, but there are lots and lots of ways to market yourself.
Healthcare entities, a hospital system or whatever, may have created a website 5 years, 10 years ago, and very rarely goes and tears it all apart and starts over. So we're dealing with old technology. When people currently try to get to it from an iPhone or a smartphone or an iPad or any other tablet device, it's clunky, it doesn't work as well. Then when they try to get information from that website, it's difficult to get to the information they're interested in. Because frankly, they were not designed by users, they were designed by providers, and providers think differently than the users are going to think, and so the websites are designed for the providers' framework of reference and not the users.
You can only guess how many pairs of eyes look at an ad in an airplane magazine, but subtly we can really measure in the online world the impact, at least in terms of exposure of various marketing methods that we can use. And the healthcare industry is gradually recognizing that, and I think is overdue in really leveraging it more.
The information's already going out. People are already researching their providers, their doctors, their hospitals, and everything else. You're getting ranked with 5 stars versus 3 stars. Healthcare industry is ranking hospitals or ranking doctors. And so what you want to do is make sure you get to control part of that message and not leave it to others to paint you the way they want to.
Until there's a change and people decide that they're not going to use the internet to research their potential purchases, inbound marketing is going to be a critically important component of every single company's marketing strategy.
Well, we already have ample evidence that some organizations are figuring this out and are moving into the digital marketing arena. So the biggest threat to those that are too slow or don't believe it's important is that they may lose in a competitive race.
You know, it's interesting in healthcare we talk about threats, mitigating liability, and what happens in the industry as a whole. What happens to the industry if we don't adopt soon, if we don't bring on things organizationally that truly can make a difference in healthcare? At the end of the day, patients suffer.
Some of them have adopted it, but other ones, they're still saying, well, what is patient engagement? If you're still asking that question, you're probably behind.
I think one of the biggest threats to not adopting the new digital technology is that over time, if you're not playing in that world, you'll become invisible to your users, to your customers, to your patients.
Somebody's going to do it right. And when they do it right in a very competitive market, the other organizations are going to start to lose market share.
We as healthcare providers, and again, I don't mean just physicians, I mean hospitals and every other kind of provider of healthcare, how we play in the digital world, how we present ourselves, how we get our information out there is going to be key to our long-term survival. And so we have to be aware of how it's done and how we can benefit from it.
They will see markets dwindling and impact decreased, regardless of what value they feel they actually bring, because they are not appealing to the way in which people are finding out about services and organizations that matter to them. So it's a pretty big threat, looked at that way, in that your whole survival will depend upon learning about and taking this kind of marketing seriously. It's a new world.